Namaste बिटिया, हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, Faculty of Homoeopathic Science at JAYOTI Vidyapeeth Women's University. Today we are going to start with a new topic in dermatology, that is Lichen Planus. It is a very important topic. Let's start with Lichen Planus. Lichen planus is a chronic inflammatory and immune-mediated disease that affects the skin, scalp, hair, nails, and mucous membrane. So it is a chronic inflammatory and immune-mediated disease that is mediated by the immune system, and it affects the skin, scalp, hair, nails, and mucous membrane. It is a type of papillosquamous disorder. And what is a papillosquamous disorder? A papillosquamous disorder is a condition which presents with both the papules and the scales, or both the scaly papules and the plaques. Examples include psoriasis, lichen planus, and pityriasis rosacea, and dermatophytosis. This is lichen planus. This is how it looks like. This is not pustular psoriasis, basically this is lichen. Now etiology. Etiology, the cause is unknown, but an immune pathogenesis is suspected. The pathology. The pathology includes hyperkeratosis, basal cell regeneration, T lymphocyte infiltration in the upper dermis. The primary cutaneous lesions are pruritic, polygonal. These are flag-top, violaceous papules, and close examination of the surface of papules often reveals a network of gray lines that are known as the Lichen lines or Lichen stria. These are the Lichen stria. Lichen stria are the whitish lines which are visible in the papules of Lichen planus, typically in the oral mucosa. These are macroscopic appearance, shows hypergranulosis. It is named after Louis Frederick Lichen. The lesions have a predilection for wrist, shin, lower back, and genitalia. The nail involvement leads to permanent deformity or the loss of fingernails or toenails. There is involvement of the scalp with lichen planopilaris may lead to scarring alopecia. The perifollicular macules are usually violet in color. Lichen planus commonly involves the mucous membrane, particularly of the buccal mucosa. The usual location is buccal mucosa, tongue, lips, and skin. The clinical features include Lichen stria, white plaques, red areas, ulcers in mouth, purplish papules on the skin. These may be asymptomatic or can be sore or painful. The symptoms of lichen planus can be mild, including white reticular eruptions to severe erosive stomatitis. The erosive stomatitis persists for years, and it has increased the risk of oral squamous cell carcinoma. Clinical features. The clinical features, it starts on the distal limbs and most commonly on the volar aspect of the wrist and on the lower back. There is intensely itchy, flag-topped, pink purplish papules. Some have characteristic fine white network on their surface called as the Lichen stria. New lesions may appear at the site of trauma, that is known as Cobner's phenomenon, and the rash may spread rapidly to become generalized. The mucous membrane involvement, comprising of an asymptomatic, fine, white lacy network of pinhead-sized white papules, that is occurring in about 2/3 of the patients. The males are affected in 10% of the cases, with changes from longitudinal grooving to destruction of the nail fold and bed. Now, the diagnosis of lichen planus. The diagnosis is done by the clinical appearances. The skin biopsy can be helpful. Differential diagnosis include guttate psoriasis, pityriasis rosacea, pityriasis lichenoides, and drug eruptions. There is another term, that is lichenoid eruptions, the eruptions which looks like lichen planus but are not actually lichen planus. So these are lichenoid. Oid means resembling lichen. Lichen planus may be associated with hepatitis C infection. Lichen planus have been observed after administration of numerous drugs, including thiazide, diuretics, gold, antimalarials, penicillamine, and phenothiazines. The patient with skin lesions of chronic graft versus host disease. The people handling color developers. There are variants of the classic picture, are rare but often diagnostically challenging. The variants includes annular type, atrophic, bullous, follicular, hypertrophic, and ulcerative types. I will repeat them again: annular, atrophic, bullous, follicular, hypertrophic, and ulcerative types. Now, the management of lichen planus. Lichen planus is usually a self-limiting disease with spontaneous remission in 6 months to 2 years. Topical glucocorticoids are the mainstay therapy. Non-steroidal creams or ointments are usually administered. Antihistamines can be given. Retinoids can be given. Phototherapy may be required for the cure of lichen planus. There are various homeopathic medicines which can be given in the case of lichen planus. The various medicines includes arsenic album, graphitis, hydrocotyle, Juglans regia, lachesis, natrium muriaticum, sepia, and sulfur. There are a lot of other medicines also that can be given, but the treatment can only be done by using a constitutional medicine. So this was all about lichen planus. In the next lecture, we are going to start with another topic. This session was powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention it in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture with a new topic of dermatology. So this was all for today. Thank you very much.